Hi there, practice members. Dr. Linker here. Wanted to bring you your video health tip of the week. So this week we want to talk about strength training or resistance training. Basically, that's anaerobic activity. So this is the sort of exercise that doesn't require oxygen. It's just you use carbohydrates for short bursts of power. So classically, that looks like weightlifting or resistance training. It doesn't mean you got to be a power lifter, but at the same time, this isn't like walking. This is something that there is something resisting your muscles as you push against it. That's that quick burst of energy that you burn up the carbs to do, and then that helps to start strengthening muscles because the muscles want to be ready for that next challenge where it's going to require strength. That's what strength training is. So strength training has a lot of the same benefits as cardiovascular training, which we went over last week, which is going to be increasing mental health and emotional health, better sleep, increasing your immune system. It's also going to increase your bone density whenever you resist, like as we're lifting weights and moving against it, you build the density of the bones because as the muscles are working, they need a stable platform to work from. So women and men that experience osteopenia or osteoporosis, they always recommend strength training, and that's why it is wonderful for that. This will help you to stay and get leaner or reduce body fat. The more muscle you build, the more calories you burn through the day. So usually the leaner most weightlifters or people that do resistance training are. So you're going to be more muscular, you're going to burn more calories. It does increase your flexibility. And then the other thing that people don't think about is if we are lifting more weights, if our muscular system is stronger, it actually reduces our risk of injury. So if you think about it, if we've been exercising and resistance training and our muscles are strong and we fall on a hip or a back, you have more protection around your bones and soft tissue, the soft tissue itself, to protect you. People that have less muscle density or weaker muscles or thinner muscles don't have as much protection. So there's a ton of benefits to resistance training. I recommend the same thing as cardiovascular, starting with a half an hour, 3 days a week, up to an hour, 6 days a week. You can go past that, but that becomes more elite athletic training, which I would be more than happy to counsel you on, but we want to start at more like half an hour, 3 days a week. So any questions about resistance training, I would be more than happy to help you set up a program, especially if you're a patient in the clinic. Even if you're not, reach out to me via email or in person in the clinic. I'd be more than happy to help. So the only caution on resistance training is that you actually need equipment to do it, and there is an increased risk of injury. So if you've never done any sort of resistance training, please seek out a professional to advise you on where to start and what to do to minimize your risk of injury. So until next time, God bless. Have a great rest of your day. I hope to talk real soon.